What up, YouTube? My name is Ahmed, and we're going to start talking about how to pass your NCLEX or how to pass your test in nursing school. It really depends on how you study, all right? If you're studying well and you're doing well in tests, then keep that same habit. If you're not doing so well, and that's probably why you're watching this video, is that you need to change your study habits. If you're doing one study habit right now and you're not doing well, change it. It's really that simple. If you're not taking that much time in studying, for me, there's other people that I've been in nursing school with that would not study as long as I have to study for a test, and they'll do as well as me. But that's a different person. Me, I'd had to put in the work, read the textbooks, watch the lectures and all that. I'm sorry that I cussed. Hopefully I bleep that out later. But that's really it. Finding your studying habits and making sure that, okay, you got to put in hours for studying for these tests, okay? Because the reason is, for the next tip, is really reading the questions on the test, okay? Because the test answers are different. Like, they're looking for different things. You got to read the question actually and figure out what it's actually asking you. Some answers on the test are going to seem very similar, seem like it's the same answer really. But you have to figure out, is it asking for an assessment that nursing is looking for, like a nursing assessment? Or is it asking for you to do an action? Is it the action of you trying to check the blood pressure, raise the head of the bed? That's an action. An assessment is, oh, you're listening to heart sounds. You're listening to, are you looking at the rate of breathing? Are you looking at if they're having trouble breathing? Or you're assessing their heart sounds, or you're assessing them neurologically. Those are assessments. And there's some questions, because not all of it's going to say what assessment, but within the questions, you have to really read and understand what it wants you to answer. Is it looking for a nursing assessment? Is it looking for an action? Is it looking for pharmacology? Like, is it looking for what drug you give, right? So those are the things you have to really pay attention on during the test. You also want to pay attention on what answer you're choosing as well, because these test answers are super similar, and some of them have the first half being correct, but the second half will be totally wrong, and it gets you on that because you have to start really reading the test. I don't really understand how people take tests and go so fast during the test, and like you see them in your class, right? They finished like 15 minutes right when they got the test. Like, I'm there till the end. It doesn't really matter who takes the longest or who takes the fastest. You're not winning a reward. It's really just taking your time on the test, especially if you're not doing well, right? Like, take your time. This is a test that you took a lot of time studying for, so please take your time during the test, okay? And then for the NCLEX, it's the same thing, right? Really look and understand what the test is asking you, okay? Because the hard thing about these nursing school tests and the hard thing about NCLEX is that it's simply not trying to trick you, but they're super similar in the answers. So you have to really understand what is it asking. And then for the next tip, okay? What about not choosing, I'm going to refer to a provider, or whenever it asks you to do a provider, or saying I'm going to tell the doctor, right? No. Usually the answers are asking you as a nurse, what would you do, okay? So what would you do during a test as a nurse? It's not practicing or testing you on what you would tell a doctor. It's asking what you would do. So usually those type of answers, you kind of want to throw those out and choose. If it says choose a provider, just X that out, or talk to the provider, X that answer out, okay? So that's another tip that could help you. And then most of the time during the NCLEX or during nursing school, you have test answers or test questions that you have no clue about. Don't just give up and then guess. Really guess smart. Look at the answer sheet or answer key, and two of them you can just X out right away, because some of them that doesn't even make sense. It doesn't even refer to the question at all, right? So you can easily take out two, and then those last two is 50-50. You don't know anyways, right? So it's just 50-50 rather than trying to do 25% or less than that odds. And then take your time for the NCLEX, okay? The hardest thing about the NCLEX, and I said this again, I'm saying it again, is that the answer key is super similar. So just to recap, for studying for NCLEX or studying for nursing school, really read the questions of the test. Look for it. Is it asking for an assessment? Is it asking for a drug? Is it asking for you to do an action, like raise the head of the bed, assessment, listen to heart sounds, right? And usually what you first do for every question, what it asks you to do first, if it asks you, what would you do first? What would you usually do for first? Assess what is going on before you do an action. So that type of question also will come up as well. When it asks you what you would do first, when you see a person that has difficulty breathing, you assess, check their SpO2. Are they actually having trouble breathing? Okay, they are. Then assess and then do the action of give them oxygen and increase to the head of the bed. So those are the good things about the test. You really have to change your habits. That's another tip. If you're not doing well in school, obviously it's related to your study habits. And there's multiple times in my life when I was studying where there was a party on the first floor of my house with my roommates. But I'm studying upstairs while there's a full party down there, right? So it's really taking your time to take that time to study and not allow others to distract you. Because at the end of the day, after those 4 years, who's going to be better off? You as the nurse, or these business degrees? Not trying to give any shit on like business degrees or not, but nursing school is hard. Really take your time for yourself and really chase your dreams, like you're chasing your dreams being in nursing school, right? So that's really all. You like, subscribe, and this was kind of out of the whim, but like, subscribe, follow me on Instagram, and yeah, give me questions down below if you want even more ideas or hints on how to study for the NCLEX. I know that was a little short, but I want you to get more questions. I want you to really understand what you want, right? I'm not just trying to throw things out there and you don't even need to know this, right? So yeah, see you.